Kinepict was installed at our clinic almost 8 months ago. The installation was quick and smooth, and since then the field application specialist visited us regularly. We treated approximately 50 patients with the help of this method. We treat a lot of patients suffered from uterine fibroid in private hospital care. Since Kinepict was installed, we were able to reduce the radiation dose by 15%. It's beneficial because decreasing the radiation exposure during the procedure is very important for the young female patients. Furthermore, we only needed the third of the contrast material compared to before. Kinepict is a big help for us. Thanks to the improved image quality, also we were able to speed up the procedure. We can use color-coded DVA, which is a parametric image processing method where the coloring represents the time of the bolus flow. Color-coded DVA can be used to visually estimate the bolus arrival time differences between vessel branches. So we can determine with perfect accuracy where is the endpoint of the embolization based on images using this method taken pre- and post-embolization.